Advocating for increased mental health funding and access. So this slide demonstrates what has led to the current state of mental health and what needs to be done immediately. This is evidenced by the fact that millions of people cannot get adequate mental health care due to financial constraints, disparities, and prejudices that stem from culture. These are not statistics that illustrate faceless people. They are fellow citizens in our towns, cities, and even in our households who suffer from ailments that, if diagnosed early enough, are very treatable. Adding to this, the statistics show that 1 in every 20 adults in the U.S. receive a mental health illness diagnosis, which indicates that most people know of someone with a mental health disorder. At this scale, it is utterly impossible as it yields a future that one is unwilling to accept. We need to focus on obtaining a much more significant amount of the required funds by expanding the number of individuals on Medicaid, which is much more limited for low-income people. We also require adequate state and federal funding to support crisis intervention programs at the community level. This means we should extend mental health services to primary care levels where possible for better and early identifications of conditions that need routing to specialized services. One that cannot be overemphasized is the need to fill the shortage of mental health personnel. This can be done by providing student loan repayment to people who agree to work in the field, especially in shortage areas, and building interstate compacts to allow those with licenses from other states to practice more readily. Therefore, the best solution to the crisis to effectively address the needs of the intended population and support the workforce funding enhancements, integrated services, and adequate workforce. With the solutions outlined in this slide, we have a good agenda to try to work towards transforming the current system into one much fairer and more productive when providing mental health services. So millions lack access to mental health. Nearly 1 in 5 U.S. adults experience a mental health illness at some point in their lives. Less than 50% of these individuals receive treatment. Reasons for not seeking treatment: limitations or lack of insurance coverage, lack of provider available in their area, or lack of funding for Medicaid recipients. Communities and schools also lack mental health programs. So the ask. The ask is government funding to support a mental health initiative, expand Medicaid to include comprehensive mental health coverage, community-based mental health services, mobile mental health intervention teams, school-based programs, and expand telehealth capabilities for rural areas. So 2, integrate mental health care into primary health care facilities. So primary health care facilities or physicians become first point of contact and early intervention training for proper referrals. 3, use funding to widen educational and training accessibility for social workers, especially in rural areas. And 4, eliminate the need to pay back student loans to individuals entering the mental health profession in high-need communities. So mental health advocates meet with lawmakers to increase funding, offer testimony to experts to shortfalls in access, and support bills to promote awareness. Increase in mental health service access would reduce ER utilization, decrease incarceration of untreated persons with mental health illness, and increase productivity. Allowing new mental health professionals to begin providing care will cut down the time people spend waiting for treatment. Social workers will work with healthcare providers, law enforcement, educators, and policymakers to collaborate to bring a more integrated approach to mental health care.